So I'm gonna level with you. I'm a little afraid of getting older. I have many reasons for this, but the main one is I'm scared of losing my mental faculties, forgetting people, directions, myself. But turns out forgetting things to that extent isn't a normal part of aging. That's actually dementia. So now the question is, what exactly is dementia? Well, dementia isn't a specific disease like depression, diabetes, or colitis. Shout out to my IBD girlies! Dementia is a general umbrella term for when someone is experiencing abnormal brain function and declining cognitive abilities because of another condition or disease they might have. As of 2022 in Canada, over 750,000 people were living with some form of dementia. And while you don't have to be elderly to get it, it's most common in older people. So if dementia is the umbrella term, what falls underneath it? Good question. Happy you asked. The most common type of dementia is Alzheimer's disease. This is when the connections between neurons are severed by floating particles in the brain called plaques, which causes a patient's gray matter to slowly deteriorate. This leads to the eventual loss of all memories and the ability to function in the most basic sense, like being able to bathe, talk, eat, and eventually breathe. But there are so many other kinds of dementia that stem from other conditions, like vascular dementia brought on by not having enough blood flow to the brain, Lewy body dementia that affects memory, movement, balance, and can lead to hallucinations, alcohol-induced dementia, dementia from having a UTI or hitting your head. The list goes on. Some forms of dementia are permanent, and the patient has to deal with them for the rest of their lives, like Alzheimer's disease. But there are others that are surprisingly reversible. For example, if it's brought on by a UTI or a vitamin deficiency. What all forms of dementia have in common, though, is that they're degenerative, meaning they start off mild with not being able to remember a name here or losing a key there, but as time goes on, they gradually get worse. With that, there's no way of knowing who will get dementia in their lives, but there are some things that make people more susceptible. These include high blood pressure, obesity, smoking, depression, diabetes, drug use, and family history. And while there's no way of preventing dementia given how many variants there are, the best way to stave it off, and this might sound boring, is to take care of yourself. Eat properly, sleep a decent amount, exercise, read books, socialize. If you like boxing or getting smacked in the head, maybe don't do that. And my favorite way to prevent dementia is to brush and floss your teeth. On a more personal note though, my nonna had Alzheimer's. One of the hardest things I've ever done was to watch everything that made her slowly get erased. But even by the end, even though she couldn't walk or talk or feed herself or remember my name, you can tell she can still feel simple emotions, like fear, love, happiness, sadness. Even though my nonna had late-stage dementia, the person I loved was still in there and deserved to be loved and cared for. Dementia is an extremely hard disease to deal with for both the patient and the family, but I'm grateful I had a chance to be there for her as she went through it. Oh, and one last thing. Seriously? Brush your teeth. And now you know what dementia is. Thanks for watching this episode of TVO's What Is Explainers. If you want to watch more like this, you can click around me. If you want to suggest another topic for me to explain, you can tweet me at 500 Days of Ariana. And if you enjoyed this video, be sure to push the like button and subscribe for more educational content. We'll see y'all later. Bye.